All right. Very good evening, Roopali. This is Abhishek, this side from Onsurity. Very warm welcome to everyone who has joined us back today with Onsurity's exclusive session. Once again, coming back to all the new discussions that we have, going on for you guys. Every time on Wednesdays, we have some power pack sessions with a lot of different insights that we bring to you, right? So thank you so much to our host for today, Dr. Roopali Sawant. Today we'll be, discussing with us about monkeypox and a lot of things that has been going around about monkeypox lately that all of us should be really aware about. And I think with this whole pandemic situation, it's been really important for people to know why and how is this viral infection different from COVID-19, right? So a lot of fear, a lot of anxiety, and a lot of nuisance is actually going around this topic, for which we actually need to get a lot of clarity as employees working in different workplaces, and be cautious about our whereabouts wherever we go, right? So looking forward to a very, very great session with you, Dr. Roopali. Allow me to quickly introduce you to our attendees today. So Dr. Roopali is an NLP practitioner with over 17 years of experience in the field of Ayurveda. I personally am a huge fan of Ayurveda because hands down to the kind of medications that we've had from this branch of science over the years, it has shown a lot of improvement across different illnesses that have constantly evolved in our world. And Dr. Roopali Sawant has completed her bachelor's in medicine, Ayurveda medicine, and surgery from Mumbai University. And she also happens to have completed her CCKP from Vaidyaratnam University, Kerala. And today we have her enlightening us about monkeypox. And over to you, Roopali. Thank you so much for joining today.
Thank you. And first of all, I would like to thank you, Onsurity, for giving me opportunity to conduct such a very informative, session about monkeypox. Because these days I see a little bit, the cases are rising. People are little, getting worried because COVID started with such a note only. So people are little hesitant, little scared, but there is not much of awareness. So I love the fact that we have this session and where we are actually raising the awareness for the monkeypox. So thank you for giving me this opportunity. So with your all permission, I would like to share my screen. Is it okay if I share my
Yes,
screen?
Roopali, please proceed.
Thank you so much.
So for everyone who's attended our session today, we'll be having a very quick Q&A session towards the end of Roopali's discussion over monkeypox. And it will be for the last 15 minutes of our call. And we would request each and every one of you to pay a lot of attention and make sure you are interacting and, putting down your questions down in the chat box so that Roopali can answer them towards the end of the session. Over to you.
Oh, thank you so much. So let me give a brief introduction about this monkeypox, because this is not a new disease. Okay, the cases have been on a rise, very true, but it was discovered a long back, approximately 1958. That was the first time when actually the strain of this virus was being discovered. There was a group of monkeys which were in the research facility, and during that time, there was a series of pox-like, diseases or eruptions on their skin, which was noticed first time in 1958. And hence the name monkeypox, because it was first discovered during that time. Though the source is still unknown, like why the monkeys got this infection, how they came across it, that is still being unknown, but it was being first discovered in 1958. However, certain African rodents and non-human primates like monkeys, apes and all, they might harbor this virus and infect people. The first ever human case which was recorded of monkeypox was 1970. So this monkeypox is not really very new. It belongs to a group of virus, like a orthopox virus, which is a family to smallpox. We'll come to that. But now this scenario, the current 2022, it's like just a little creating a scares among worldwide, because on the similar note, coronavirus started 2020 May. So people are a little scared about this. So for the first time, after this outbreak of monkeypox, several countries apart from the belt of Africa, Central Africa or Western Africa, are reporting cases associated with this monkeypox. Now we have to take into consideration that 1970, 1980, 1990, there were cases of monkeypox, but more or less they were related to the central belt of Africa or to the western part of Africa. So never has been like the cases on a surge or on such a high rise outside the African belt. It can be attributed to the fact that because of the traveling part, international traveling does play a lot of role, and that's how the transmission of the disease happens. But in certain scenario, the transport of the the animals, for that matter, for some research facility or from some other perspective, even that is being increasing or leading to the monkeypox cases outside the Africa belt. Otherwise it was related to just that African belt. But if we understand a little bit about this monkeypox virus, now virus has this is a double stranded virus, and that's why it is creating or more nuisance in human beings, because human beings also we have do double strand DNA. So that's why this virus is able to affect us so deep down. It is a stranded DNA virus, a member of orthopox virus genus in the family of Poxiviridae. Okay, it belongs to smallpox virus family. Now, smallpox, we all know it has been eradicated for quite some time now, and that's why certain people, they have developed a kind of immunity to this virus because they belong to same virus family, and we all have been vaccinated for smallpox. But that is also creating a hurdle. Okay, that is also creating a hurdle when we talk about the treatment part. Now, various animal species have been identified susceptible to monkeypox virus. So it is not just humans, but animals are, also getting affected, primarily mammals. And in humans, monkeypox is usually a self-limiting disease. It gets rectified on its own, though severity from patient to patient differs, ranging from 2 to 4 weeks. That's usually the period for it. Severe cases can definitely occur in those people whose immune system is severely compromised. Ultimately, everything is coming to immune system. So I'm going to talk from that part, from the Ayurveda perspective. And in recent cases, the fatality ratio has been around 3 to 6%. Okay, though it's not a very deadly disease, like we had a wave of 2021 में Delta strain of coronavirus, it's not that deadly. उसका fatality भी इतना नहीं है, but nevertheless, severity of symptoms is too much, and that's why the people faces the gravity of these diseases as well. Monkeypox is a viral zoonotic disease, we say, which is zoonotic means it can be transferred from animals to humans, and seldom humans also do transfer it to the animals. So that is what we term as zoonotic disease, and that is occurring primarily in rainforest belt areas of Central and West Africa, and occasionally other areas of the world. But right now, in current scenario, according to the CDC data, okay, that stands for the central data for the communicable diseases and all, उनके research के हिसाब से as of now monkeypox के recorded cases are 21,000 all across the world, and 76 countries have been affected with these cases. And certain countries, especially like India and all, certain countries are reporting this 2022 में first time, or they are recording first cases of monkeypox. उसके पहले monkeypox का कोई नामो निशान नहीं था, but certain countries are recording these cases for the very first time. Usually India में भी इतना नहीं था, but right now 8 people, as of today's data, 8 people have been diagnosed, and one death has been also reported.
Sorry to interrupt you. Could you
Sure.
go to the slide you're talking about? Because I think
Sure.
we're still on the first slide.
Sure. No, usually I keep on the slide,
Okay.
but I do talk a little bit more about the slide.
Sure, got it.
Okay. Now let's talk about how this disease is spreading. Okay, it's very important for us to understand what are the preventive bases. We will understand the prevention when we understand how it is usually spreading. Otherwise, there is a lot of false information floating in the market. So monkeypox spreads in a few ways. Animal to human, that is zoonotic transmission, can occur. either with a direct contact, either if we are touching an animal, like if we are dealing with animals and all, unke blood ko ya unke body fluids ko, if we touch
Rupali,
accidentally and we are not
could
wearing a
you
mask, we are not wearing any kind of gloves, we have any kind of injury, तो वो directly infected animal से it can, you know,
Rupali,
get
sorry
transmitted.
to interrupt you, ma'am, again. Could you
Sorry.
please check if your screen is frozen? Because we can still see the monkeypox first slide. Are you on another slide right now?
Yes, I am on the how does it spread.
Yeah, great. Could you display this on full screen?
Just a second. I think I just changed it, but okay, let me try.
Yeah, I think.
So can you see the slide? How
yes,
does it spread?
yes.
Okay. So
Thank you.
monkeys, welcome. Monkeypox can also spread to anyone through close, personal, and often skin to skin contact, including direct contact with patients when we are handling patient of monkeypox rash, or dealing with their swabs or body fluids from person, or with any kind of animal for that matter. Touching fabrics, okay, clothing, bedding, towels, tissue papers, or any previously touched surface by them. If we are touching it, it can get transmitted to us as well, or contact with the respiratory secretion. This direct contact can happen even during the intimate contacts like oral, anal, or vaginal sex, or touching the genitals, the penis, testicles, or any other private area parts, even the butthole of a person with a monkeypox. So it's like a spreading to that area as well. Hugging, massage, or kissing part, prolonged face-to-face contact, touching again the fabrics or object during the sex like condoms and all that were earlier used by the person. So these are the way this monkeypox is being spreading among patient to patient, human to human. The transmission is happening at a very speedy rate. So can you see my other slide? I have changed my slide. It says how does it spread, but the context is different. Can you see that?
No, you will have to go to the 5th slide, I guess.
Okay. So a pregnant person, a pregnant lady for that matter, can also transmit this virus to her fetus via placenta. And it is also possible for people to get monkeypox from infected animals as well, either by being scratched or by bitten by them, by that animal, or preparing their food or eating that particular animal ka meat and all, or which has been infected. A person with monkeypox can spread it to others as well from the time symptoms start until the rash has been fully healed. Now, monkey rash usually appears on your extremities and your face, and the person is infective right from the rash starts appearing till the rash has been fully healed. That period is still an infective phase, so that is the period we need to stay away from such people. Okay, and जब तक वो लेजन पे एक fresh layer of skin नहीं form हो जाती, they can still infect the other healthy humans. Okay, and this typically infective period lasts from 2 to 4 weeks. Still, research is still prima facie going on to evaluate whether this virus can be spread by a person who is asymptomatic, as it happened with COVID. Though I might be asymptomatic, but still I was able to spread COVID or the coronavirus. So still prima facie research is being taken ki whether a asymptomatic patient with monkeypox can transmit this disease to or not. So that is still under the current research only. So let's see and understand what are the signs and symptoms of disease. Typically a rash, a typical rash, just like a smallpox ka rash.
Roopali, you will have to click on the slides. I think we're still on slide 4.
Okay, still on the slide 4. Okay.
Yeah, we can see the signs and symptoms now. Yeah, thank you.
You can see this signs and symptoms now.
You will have to present your screen. I think you stopped presenting it.
Okay, just a sec. I don't know why it's happening.
Yeah, I think it's visible now. Yeah.
Okay. So let's figure out certain signs and symptoms. Headache, fever, exhaustion, swollen lymph nodes, muscle aches, lesions. Very primary and the most common typical symptoms of this monkeypox. Backache, and even sometimes the fever is associated with chills. Okay, a typically rash starts appearing after the first week of your infection, and it lasts usually till the fourth week of your period. So certain rashes do start healing, and certain rashes are still fresh ones. The fresh eruption still happens till fourth of the week. That is the incubation and the you can say of this virus. So I'm changing my slide again. If you're not able to view, let me know.
We can see now.
Okay. So incubation period, that is the interval from infection to the onset of symptoms, okay, of monkeypox is usually from 6 to 13 days, but can range from 15 to 21 days. It's not necessary कि if I am coming with a contact of a patient who has or had an infection episode of monkeypox, after meeting him or her, I might develop this disease after even 10 or 12 days. So the incubation period is usually from 5 to 21 days, but in certain cases, it is 6 to 13 days as well. If we see this disease, we can divide it into two parts, the invasion period and the skin eruption period. Now the invasion period, it usually lasts from 0 to 5 days. Okay, जब वो वायरस हमारे बॉडी में घुसता है, it's destroying or disturbing the harmony, हमारा immune system is fighting. That is usually the invasion periods where your WBCs and everything is trying to make antibodies, trying to fight this disease. This is an invasion period. यहाँ पे symptoms are not fully manifested. So this is characterized, starting में धीरे धीरे fever आना शुरू हो जाता है, थोड़ा बहुत headache हो जाता रहता है, lymphadenopathy is sometimes there, back pain might be there, myalgia might be there, or you might be asymptomatic as well. It might happen. Or maybe a severe fatigue, lack of energy. Now lymphadenopathy is a very distinctive feature, okay, जहाँ पे lymph nodes में थोड़ा swelling मिल जाता है, and this is the most अगर rash नहीं है तो this is the most definitive clinical characteristic जहाँ पे हम बोलते हैं कि let's evaluate for the monkeypox and all. So जहाँ पे it is differentiating this monkeypox from the other viruses like chickenpox, measles या smallpox से भी. Now skin eruption, the rash which starts appearing, it usually begins जहाँ पे fever थोड़ा सा आने लगता है, उसके 1 से 3 दिन के बाद this rash starts developing. Now the rash is more concentrated on the face part and the extremities rather than the body part. Okay, majorly face पे और हमारे हाथ या फिर हमारे legs पे it is more visible and more intense. 90% of the rash is on this area.
So I think the cue here, Roopali, is to make sure that people don't confuse pimples with rashes that are usually formed during monkeypox. And I think
absolutely not.
With this whole fear that is going on, I think the more we know about these symptoms and the more we sort of understand what kind of eruptions or sort of asymptomatic problems can occur, it's very difficult to identify whether it is really monkeypox or not. And I think you made a very clear point here to sort of distinctify whether it is really monkeypox or not, and see if it is not just a regular symptom. So yeah.
And I also feel let's not do a self-diagnosis. If the fever is there, little swelling in the lymph nodes is there, and if it started, just meet up a doctor so they are able to better diagnose it. And rashes is to definitely confirmative. I'm going to show you the pictures of rashes also. So as you say, you shouldn't mistaken it with acne because it's vaguely and very usually different from acne. So it cannot be at all confused. It might get confused with chickenpox or smallpox, but definitely no to pimples. So usually oral mucous membrane, even your oral cavity is affected in 70% of the cases. Certain part of your genitalia is also having this rashes and all. And they are a little filled, formed lesions. They are very firm. They are not very flabby, they are not very softy, they are very firm lesion. Apart like from your pimples are little on the softer version, but iske lesions aise nahi hote, they are very firm. Okay, papules jaise typically hote hain. And number of lesions vary from person to person, like kai logon mein it's too much, whereas in few people it's very limited, a basic here and there rash is there. And in certain countries, in certain, especially in African countries and all, entire face and entire the extremities are filled with hardcore that the macules and the papules. Okay, very firm lesions they are filled with. And usually the scaling starts off, but that is after happening 2nd or 3rd week. So during that time we have to just wait and take proper medications and hydrate as well. Okay, because still we are into a infective phase.
So I think, doctor, it's very, very important for someone to actually go and consult a doctor, because someone who's probably having another autoimmune disease within them, it might be really difficult for them to identify whether the symptom is really of monkeypox or not. I think the early signs is the first sign for a person to go and look a doctor. Is what I feel.
Definitely, and it also decides the pace of our healing. Our recovery is also dependent on that.
Right.
Moving on, usually I have changed the slide, so I think you are
Yes,
able to
yes,
see the
yes. We
slide.
can see. Yes.
Now, usually this is a self-limited disease with symptom lasting from second to 2 to 4 weeks, and it is usually little more common among children. Okay, because unka immune system is little down, and somewhere you can say the complications are also more associated with teenagers or children. Although vaccination against smallpox was protective in the past and we have eradicated that disease, but today persons younger than 40 or 50 years of age, depending of course on the country, they are more susceptible to monkeypox due to cessation of smallpox vaccination. Now, since we have eradicated smallpox virus, in certain country this smallpox ka vaccination is not being done, because this globally we have eradicated this disease, and that is posing a little huge hindrance in the controlling of this disease. And even the complication, the secondary infections or the secondary symptoms which are setting up, it also is usually hugely dependent whether the people have been vaccinated for smallpox or not. For that matter of India, in India, like we are still continuing with the smallpox ka vaccination. Like in the like at least we were younger, we have got that shot and all. So case of fatality ratio is 0 to 11%, but among those people who have not been vaccinated for smallpox, or those who have a severely compromised immune system, like they are ongoing cancer patient taking treatment for tuberculosis, or HIV patient, or some any other condition where their immune system is usually compromised. Only in those people the severity or the fatality of this disease is being noticed. So there are certain signs and things, or certain I would call red flags, which we have to watch out, and if they exist or they appear, we have to consult a doctor ASAP. For example, fever associated with chills, headache, muscle aches, backache, swollen lymph nodes, chills, exhaustion, unexplained exhaustion. आपने कुछ किया नहीं है, but you're getting tired. Or respiratory system like sore throat, nasal congestion, cough, or a rash which is typically starting to look like a pimple in the start, but definitely it's more of a blister or a pustule kind of a thing, and very firm and very painful as well as itchy. Okay, so this is what exactly a rash looks like. Can you see the picture of the rash over here?
Yeah.
Okay. So this is a typically 3-case scenario where the exactly rash, in some cases it's looking like in the middle finger, middle picture mein just like a acne, but यहाँ पे first picture में it is more kind of a pustule, whereas in third में it is just looking like a boil. Okay. Excuse me. So let's not get confused. If rash is typically present along with fever, and rash is appearing after fever, like 1 to 3 days के बाद, the rash is typically appearing, and more if it is concentrated on the face and the extremities, it's ASAP basis pe we have to meet the doctor. Now, I believe prevention is a better approach in any kind of immune related or any kind of viral or bacterial kind of response. Because when we prevent any diseases, we are not testing our body, okay? Because वो कैसे fight करेगी, antibodies बनेंगे कि नहीं, severity कैसी होगी. So prevention is always better than treatment. And raising awareness of this risk factor and educating people about the transmission, okay? How we can take care of ourselves. We can wear a mask, we can wear a gloves while handling particularly patient suffering from monkeypox, avoiding skin to skin contact, okay? Like shaking hands and all. what we had previously avoided in COVIDs and all. So we should follow this same things even during this monkeypox ka the cases and all which are globally hitting these days. Washing your hands, washing your vegetables thoroughly, okay. Keeping your pets also safe if you have any kind of pets, okay. Or avoiding as of now going to any zoo or getting close contact with any kind of animals for that matter. If you're eating any kind of exotic meat, be thoroughly ensure that you're cooking that meat properly, washing that meat properly before cooking and all, because that is how we are going to prevent that. And of course, it is a sexually transmitted disease also, it can spread through that also, so we are going to take care of that as well.
So,
So raising
very
awareness.
quick question, Roopali.
Sure.
So, for all the attendees here, I think a lot of people have started going back to office since offices have opened up and people are quitting work from home again. What do you think is the best preventive care someone can take while they are traveling to office, or while they are working with their colleagues in a co-working space?
Okay, so similar preventive measures we are going to follow what we have followed actually in coronavirus, like staying, keeping some social distancing, wearing a mask. If anyone is having a fever, okay, if you yourself develop a fever, start wearing a mask. Okay, max to max, what will happen? Ki it is not monkeypox, but it might be a viral, and you're saving another person from that viral. So wear a mask, wash your hands whenever it's possible. Whenever you're eating any kind of meat particularly, don't go for any kind of exotic meat as of now. Avoid any close contact with animals. If you have pets, ensure that they are not having any kind of disease, because as I said, it's a zoonotic disease, it can be transmitted from animals to humans, so we are going to be careful in that. And of course, certain things also relation to the keeping sexual contact not with the strangers, only with the known people or with your loved ones, because that is your assurity. And taking care of your secretions as well. If you're sneezing, if you're coughing, cover your mouth, okay. Keep a hand, carry a handkerchief, wear a mask, okay. These are the things we are going to follow even in during this monkeypox outbreak, the same approach what we had during coronavirus.
Thank you. I think that answers the question. Yes.
Okay. So let's avoid the close contact. Even if a patient has been, the way we were quarantining, the COVID patient into different room, different bedding and everything. If any loved ones or near ones are having this monkeypox, we can quarantine them as well. Okay, keep their bedding, their clothing, everything separate. Even when you're taking their clothes for a washing and all, wear a gloves so that you don't contaminate yourself. We never know, we sometimes have superficial cuts and all while working in the kitchen or working in, outside, or some things we have superficial cut, so the transmission might be very easy. So when we are handling any patient, even in hospital, even in home, we have to be very very particular while handling their clothes, especially giving them food, washing their utensils, okay. Or close one-on-one contact, we are going to avoid that. Better immunity, I mean a better health, okay. So first and foremost, even if we don't have cases as of now itself in Bombay or any part of the country right now you are, but better health is only attributed if we have a better immunity. And for good immunity, you're going to include wholesome foods, okay. Focus on mindful eating as a ritual. We are talking, we are we are jumping, we are laughing, watching Netflix, Amazon Prime, and we don't know what we are stuffing. So don't fall into that trap, because mindful eating is good for your digestion. Wholesome food include plenty of washed vegetables, fruits. More importantly, they are very good sources of phytonutrients, and phytonutrients your body needs, especially like vitamin C and all. It is good to build your immunity with it. Seasonal fruits are must. Whatever seasonal fruits or vegetables are there, do include that. If you're a non-vegetarian, wash your meat products thoroughly, okay, and properly cooked it. Don't go for the sushis or any kind of raw meat preparation as of now. Not even the raw eggs. If you're fond of your protein shake and you're using a raw egg, just kindly avoid it as of now. Better to have a omelette or a boiled egg format rather than taking it like in a slurpee or a half done format. Proper cooking of the meat. Include spices more like a turmeric, because to a matter of fact, turmeric contains curcumin, Okay, and even US had taken a patency from India regards to turmeric, that we have identified it's antiviral, antibacterial, anti fungal. But nevertheless, we are using for centuries turmeric like that because of the curcumin ingredient in that. Curcumin is not only able to resist most of the bacterial infection, but viral as well as fungal infection. That's in majority of the cases, and that's why many of our cases में when we talk about Ayurveda, तो हम जब आयुर्वेदा में ट्रीटमेंट देते हैं स्किन डिसऑर्डर्स के लिए, लेट इट बी एक्ने और लेट इट बी एनी काइंड ऑफ रैश, सोराइसिस या मंकी पॉक्स के रैश होने दो, उसमें टर्मरिक प्लेज अ वेरी क्रूशियल रोल बिकॉज ऑफ दिस कुरकुमिन. कुरकुमिन इज वेरी hepatoprotective ingredient, मतलब liver friendly food है. So do include turmeric in any form, maybe your golden milk, or just boil a turmeric in your water. Now funny thing with turmeric is that कि turmeric आप ऐसे ही लेते हो ना, it's not being absorbed by your body. The bioavailability of this curcumin तभी होती है when you boil this turmeric with something, and that's why traditionally in India we have that that golden milk. हम हल्दी वाला दूध पीते हैं. The only reason जब हम हल्दी को boil करके लेते हैं, उसका ये curcumin is easily available to us. So right now even the rainy season is there, so a lot of infection, viral, flu related are happening, and that's why turmeric is best as of now. आप उसको जरूर include कीजिएगा. Definitely ginger also, it contains gingerol, again good component for your immunity. Garlic too, black pepper, coriander seeds particularly, ऐसे spices जो हमारे home basis पे हमें बहुत easily मिल जाते हैं, and they give you a good surge of immunity. They are not only acting as prebiotics, but कहीं ना कहीं detoxification भी करते हैं. Funny thing, आपका digestion, it also kills your lower part of your stomach. जब digestion होता है, वहाँ पे most of the bacteria जो food के through entry लिए, वो बहुत सारे detoxify होते रहते हैं. So that's why digestion also plays a very crucial role in your immunity. Okay, gut health sound होना बहुत जरूरी है.
Because Roopali, one question. Now, say there are a lot of there are a lot of employees per se, like me. I don't have a cook who makes food for me, and I usually rely on the food that I get in my office canteen or in the nearby places, outside office, right? Could you suggest some really quick diet tips which someone could maintain in order to have a good immunity? Now, say they want to rely on office canteen only, right? So what could be some really easy to munch on foods which you think are actually safe and would help them build a good immunity?
So looking at this monkeypox ka scares, I would say rather prefer a cooked meal, okay, rather than eating raw salads or going for a sushi item. These days you can prefer a cooked meal jahan pe you're eating cooked vegetable with roti and whatever sabzi you're preferring, but in a cooked form, nothing partially cooked. Even if you're going for a chicken and something like that, don't go for a chicken ka salad where the chicken is half done. Maybe a properly cooked chicken, or a grilled chicken, or maybe don't avoid even the fried chicken for that matter of fact, because again frying is going to add saturated fats to your body, which is going to slow down your digestion. So choose grilling option over frying option when it comes to meat, and cooking properly. That would I say. See, if you're eating outside, avoid bread as much as you can, because again bread ke preparation mein a lot of margarine goes, and it is slowing down your digestion. So instead of bread, you can maybe use a roti, okay, gehu ka roti or any kind of millet ka roti. And one thing, even as a working individual, what you can follow is you can carry small bits and pieces of ginger ka slices with you. I don't know if you ever heard about the Japanese people. They do have this ginger slices, okay, they eat after every meal. This ginger is very good immunity booster. So just having any outside food ka meal, maybe lunch or dinner whatsoever, half an hour prior, it is very easy to carry that thin ginger ka slices. Just sprinkle some black salt and carry it, okay? Or khana khane ke pehle just you eat that one slice of ginger. That is also a good probiotic cum prebiotic, and it will take care of not only your immunity but as well as your digestion. Just half an hour. Weight loss bhi usse acha ho jata hai. So you can try this. Okay. Even vitamin C is good, so you can include lemon juices instead of lemon soda or alcohol. Lemon juice, but not cold water or not with the ice and all. Plain lemon juice is also okay with little salt. And if you're fond of you're not having any kind of aversion to sugar, then you can include little brown sugar or jaggery to it. Work out regularly and improve flexibility, so that your skin gets readily detoxify, your body is also healthy and generating sweat, because sweat के माध्यम से भी बहुत सारे toxins are being flushed out. Pranayam is way too good technique because it is strengthening your respiratory tract. तो बहुत ज़्यादा complicated प्राणायाम नहीं करना है. अगर आपने 10 deep inhalation exhalation morning में किया, it is keeping your respiratory tract very healthy. It's a good exercise for lungs, and this can be done any time of the day. So I think this chota things we can definitely incorporate on day-to-day basis, जिससे हम थोड़ा सा we can be focused on health. If you're drinking any kind of ready to drink juices outside, avoid that. Season wise also it is not good, because we don't know what kind of water is used. वो fruit कितनी देर तक open करके रखा था, cut करके open करके रखा था, उसके antioxidant बहुत destroy हो जाते हैं when we cut the fruit and keep it for a longer hours. So don't rely on this outside food, fruit juices. उससे अच्छा एक fruit लेके खा लोगे, that would be better. You can carry your fruits, okay, maybe a banana or maybe a pear or a apple to your office. वो तो आप easily carry कर सकते हो. Even if you don't have cook, if you don't have anyone to cook food. Fruits carry करने से दो फायदे होंगे. एक तो कि आपका बाहर का food का consumption कम हो जाएगा, और secondly it will be a good source of phytonutrients. जैसे बहुत सारे हमें beta carotenes, even for that matter potassium वगैरह हमें बहुत सारे fruits से मिलते हैं, selenium and all. So you can carry that, I feel. So here I have ended my session, guys. If you have any doubts, you can ask me.
Everyone, you can please put down your questions now on the chat box. We will have doctor answer them. Meanwhile, I have a quick question for you, Dr. Roopali. So,
Okay.
say from the field of Ayurveda, like when we talk about the branch of Ayurveda, apart from following hygiene and regime, like doing yoga or doing pranayam, what are some natural remedies that you think would help someone boost the immune system? Because I feel monkeypox is probably just one illness that has come up, but I think down the line there could be a possibility of a lot of viruses coming in the next 5 to 10 years, right? So I think having a good immunity over the year would help us a lot. But what are some really natural remedies that you would suggest someone can easily do at their home if they want to have a very good, say, immune system?
Okay, so one thing is amla is very good from that perspective, okay, because there is a proverb saying an apple a day will keep doctor away. But apple is not suited to all the prakritis, what we say in Ayurveda. Rather, amla is the only citrus fruit which is suitable to all the phenotypes of the body. हर किसी को easily digest हो जाता है. Those who have little cold, वो थोड़ा black pepper के साथ ले सकते हैं. It's a very liver friendly, food, and especially I have seen working people, they are more prone to, late night parties जहाँ पे late खाना होता है, alcohol होता है, smoking होता है. So these are some toxins to your liver. And liver is the most compromised organ, I feel. Liver, अगर मैं liver के बारे में बात करूँ ना, तो you might feel कि मुझे liver से प्यार है. But what I feel कि लोगों ने liver को बहुत बर्बाद करके रखा हुआ है. And कहीं ना कहीं immunity के लिए बहुत crucial role हमारा liver play करता है. So ginger, your amla, okay, these things, two things are very very suitable to any kind of prakriti. और हम ये easily कैसे भी incorporate कर सकते हैं. A fresh ginger maybe, or सौंठ का पानी, even turmeric for that matter, excellent immunity booster, right, to improve from your digestion to even disease like diabetes or even disease like psoriasis. हर जगह ये हल्दी यूज होती है.
जिंजर को तो आपकी आवाज म्यूट हो गई है.
Is it?
Yes, we can hear you now.
Okay, so ginger को we in Ayurveda we call universal medicine, विश्व औषधि का है, because osteoarthritis से लेके immunity से लेके सबके लिए वो काम कर रहा है. So ginger, amla, turmeric, okay, even for that matter your नींबू, okay, lemon, वो भी हम ले सकते हैं. It is a good source of citrus, vitamin C. एक आंवला में अप्रोक्सीमेटली 10 ऑरेंजेस जितना विटामिन सी होता है. सो आप 10 ऑरेंजेस खाओ या एक आंवला खाओ, विटामिन सी आप सोच लो. सो इट्स वेरी हैंडी, हम वो रख सकते हैं. अपार्ट फ्रॉम इट आप रेगुलर बेसिस पे ग्रीन कार्डमम भी ले सकते हो. इफ यू आर मोर प्रोन टू कॉफी और कैफीन एडिक्टेड हो या फिर अल्कोहल एडिक्शन है जिससे लिवर सप्रेस हो सकता है, सो ग्रीन कार्डमम जो हमारी ग्रीन इलायची आती है उसकी पाउडर इज कंसिडर्ड टू फ्लश ऑफ द कैफीन का आफ्टर इफेक्ट, तो वो भी काफी लिवर फ्रेंडली है. सो यू कैन इंक्लूड दैट एज वेल. हम डेली बेसिस पे या तो एक माउथ को स्मेल भी अच्छा देगा, सो हम वो भी खा सकते हैं. इवन फेनिल इज अ गुड डिटॉक्सिफायर, वो भी हमारी सिस्टम को बहुत इम्यूनिटी को अच्छे से बढ़ाएगा. एंड इफ टेकन विद द बीटल लीफ, जो पान कहते हैं ना हम लोग, जो पान के साथ लोग खाते हैं, उसके साथ सौंफ इज एन एक्सट्रीमली गुड डाइजेस्टिव मेथड. तो जिनका डाइजेशन वीक है वो ये भी चीज ले सकते हैं. जो इम्यूनिटी वाइज वीक है वो च्यवनप्राश ले ले. ओके, च्यवनप्राश इज अ गुड सोर्स ऑफ आंवला. ओके, वो आंवले से ही बनता है. एंड ये सोना चांदी च्यवनप्राश कुछ नहीं होता, दिस इज जस्ट अ मार्केटिंग आइडिया. सो च्यवनप्राश इज ट्रूली एंड मेजरली बेस्ड ऑफ आंवला. सो जो सीवियरली कॉम्प्रोमाइज है वो ये भी ले सकते हैं. आपको लग रहा है बहुत स्ट्रेस है.
Right. We have Kishore who had a question based on the similar suggestions that you were giving. Does ashwagandha really benefit in terms of immunity boost and stress relief both?
Immunity, okay. Stress, perfect. Because ashwagandha is one such clinically proven herb which acts upon your hypothalamus, and also it is proven result ki jo cortisol which is getting secreted even for the shorter duration in your body in a response to stress, uske after effects ko wo kam karta hai. So stress ke liye ashwagandha is way too good. Stress ka effect aapke endocrine system पे, especially ovaries, testes, adrenal glands and heart पे एंड ब्रेन पे, इन 4-5 पार्ट पे ना है, इसमें अश्वगंधा बहुत ब्यूटीफुली काम करता है.
Got it. We have Piyush asking us, can this spread through food? For example, if food is prepared or delivered by an infected person. Monkeypox.
Yes,
this is with respect to monkeypox.
It can. If we have taken any kind of animal food, okay, or if we are taking any kind of raw delivery like a vegetable and all, and in fact it has been touched by an infected person, and immediately if we are touching it, yes, there is a possible transmission. But if we are immediately washing it and washing our hands, so there we are cutting down this infection.
Correct. We have Renu Kumari asking us, what about Gulkand? Do you think Gulkand has a lot of benefits? Because usually we have that ingredient very common in drinks, in desserts, in betel leaf, but does it really have health properties?
No, actually no. Gulkand is just loaded with sugar, I would rather say. Okay, so glucose बढ़ाने के लिए it would be great अगर आपको glucose चाहिए, but otherwise no such as such benefit what we can attribute. उससे अच्छा एक piece of jaggery खा लो, you'll at least get good source of iron from it.
Wonderful. I think that really answers all the questions that we had from our panelists today. I have another very quick question. Personally, why? Because I am really, a very health conscious person. So I think when it comes to immunity, I am very conscious about making sure that whatever food I intake is, having a proper balance of vitamins, minerals, proteins, carbohydrates, all of that. So does this have a very important significance in your entire body build? Because I think food is a great component, but alongside that, there are people who also prefer consuming a lot of fluids or a lot of water-based diet, right? So do you think it is important for anyone to have a balance of both liquid as well as solid diet?
I think there should be, because now there is a wonderful shlok. I won't say it in Sanskrit, otherwise वो bouncer जाएगा. But it is said कि जब तक हमारे मुंह में दांत है ना, we should chew the food and eat. जब दांत नहीं होंगे, that time we are taking liquid, it's okay. Because liquids, again, when we drink liquids, we have to keep it in mind, kidneys are getting overburdened. Okay, there might happen an electrolyte ka imbalance. So just drinking lot of fluids, lot of water and avoiding solid won't be a good way. So there should be a balance. Your carbs ka, your proteins ka, because each and everything has its own benefits. Carbs are your energy givers, protein are your bodybuilders, fats again are your energy givers. तो हर एक का अपना अपना किरदार है. फाइटोन्यूट्रिएंट्स आर योर एसेंशियल फॉर योर सेल्युलर एक्टिविटी, जो सेल्स बेसिक सेल्स का स्ट्रक्चर है, लाइक वी लर्नड इन द केमिस्ट्री. तो फाइटोन्यूट्रिएंट्स वो एंटीऑक्सीडेंट देते हैं, वो कहीं ना कहीं हमको वो सेल्स की इंटीग्रिटी मेंटेन करने के लिए रखता है. तो आई थिंक देयर शुड बी अ बैलेंस. Just by staying on liquid is going to create a lot of electrolyte imbalance and a load on kidney in the later life.
Understood. Thank you so much, Dr. Roopali Sawant. It has been a great session. Quote unquote to everyone who is listening us today in Onsurity's Wellness Wednesday. Doctor said it that, whilst you still have teeth, you should keep eating and chewing healthy food. You should maintain a good diet. And keep your eyes and ears open to make sure that you're noticing every symptom that could possibly affect your immune system, right? And having discussed everything about monkeypox today, I personally have a lot of insights about what I need to keep a check on. And all of us today, should make sure that, whether we are sitting at home, going out for parties, going to our workplace, we should keep a check on our immune system so that there are least chances of us being affected by this disease. Although the numbers seem very overwhelming when we talk about the whole worldwide exposure to monkeypox, but today knowing that this is a disease that we should be precautious of, it brings me to the only important point that I would like to highlight, which we always keep saying in our Wellness Wednesday sessions, that smile and make sure that you are also taking care of your wellness whilst you still have teeth, right? So smile whilst you still have teeth, and smile whilst you are doing a great job looking out for your own wellness here, right? So it was a wonderful session again. Thank you, Dr. Roopali. We look forward to having such wonderful sessions with doctors like you, and making sure that all our attendees are learning something really great every Wednesday with us. Thank you so much. And
even I want to thank Onsurity for this wellness initiative and bringing very insightful, meaningful, and a practical, very online live sessions for their content for their members and all. So I'm really very glad that Onsurity is such a pioneering contribution they are regards to the healthcare of their employees, and when they are a huge and a very good wellness brand. So I thank you for them. I thank you as well. Thank you.
Thank you so much, Doctor.